And thank you for joining our second COVID-19 briefing this week. Because we only have one speaker today and due to a time constraint, today's briefing will run only until 10:30. As always, we're being joined by Acting Health Commissioner Dr. Shara Budagul. As we did earlier this week, members of the public who would like to watch today's briefing are directed to view the live stream on the Health Department's YouTube channel. As always, we will present remarks first in English, then in Spanish, then open up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions, and that for today, we limit those questions to 2 or fewer due to our limited time. If we have time for a second round of questions, we'll allow that. Please keep your questions focused on the topic of the COVID pandemic and the city's response today. With those instructions out of the way, Dr. Budagul, could you please start us off?
Good morning, everyone, and thank you for being here today. Due to the rapid rise in COVID-19 cases and hospitalizations, last night, Philadelphia's Board of Health passed a new regulation aimed at keeping our city's most vulnerable residents safe and at decreasing the spread of infection. Starting on October 15th, all healthcare workers in the city of Philadelphia will be required to be vaccinated against COVID-19 unless they have a religious or a medical exemption. Healthcare workers with an exemption will be required to have a PCR test or an antigen test twice per week. Also on October 15th, all staff, students, and faculty at colleges and universities in the city will also be required to be vaccinated against COVID-19 unless they have a religious or a medical exemption. Colleges and universities will be required to offer one or more of the following accommodations for those with exemptions. Option 1 is PCR testing once a week or antigen testing twice per week. Option 2, for those colleges and universities with 90% or more of their population vaccinated, they can choose to offer those with exemptions the option of double masking and keeping at least 6 feet of social distance in indoor public spaces. Or option 3, if feasible, colleges and universities may choose to offer those with exemptions a virtual option as their accommodation. The Board of Health also passed an amended version of the mask mandate we announced on Wednesday, with some changes based on input from the public. You've already heard from me about the rate of rise in cases and hospitalizations, which combines with the data from around the country to paint a dire picture of what our future could hold if we do nothing. These regulations are aimed at protecting the most vulnerable through the vaccination of healthcare workers. And they're aimed at preventing the further spread of COVID-19 through the vaccination of college and university students, understanding that young adults are the population with the lowest vaccination rate and the highest rate of COVID-19 infection. We've tried a wide range of incentives in Philadelphia, from Phillies and Eagles tickets to our vaccine sweepstakes. But at a certain point, with cases soaring and hospitalizations on the rise, we have to act. There are hospitals in this country that are full, where soon doctors will be in the position of having to decide which critically ill patient gets the ventilator or the ICU bed, and where emergency departments will be telling ambulances that they have to drive to another hospital, even if that hospital is miles away. People who need emergent care for heart attacks, strokes, or trauma will wait longer. And for some of them, that extra time will be too long. We cannot let that happen here in Philadelphia. We have to act. I have no doubt that there will be some pieces of this that we will need to tweak or change in the coming weeks. But by making this announcement now, we're giving time to the city's healthcare workers and college students to do what they need to do and get vaccinated, and to the institutions that they are part of to prepare. As an example of that process, based on public input on the mask mandate, the Board of Health passed a few minor changes to make the mandate less worrisome for parents of children too young to be vaccinated. These include a new category of essential businesses, including grocery stores, pharmacies, doctors' offices, and urgent care centers, that will simply have a mask mandate and for which the vaccine mandate mask-free option will not exist. That way, parents do not have to worry that they'll be unable to stop by the grocery store with their children. And I do want to mention that for those concerned about their ability to take their child to a restaurant bathroom, We would not consider quick masked bathroom trips to be a violation of the mask mandate for those establishments that are taking advantage of the exception to the mask mandate for vaccinated only establishments. These new mandates, together with the mask mandate announced earlier this week, add additional layers of protection for Philadelphia residents. We will need that protection as COVID continues to sweep across the country. But by taking these measures now, we hope to be better prepared for the weeks and months to come. Thank you. Armando will now present these remarks in Spanish.
Actualización en materia de salud para el día 13 de agosto del 2021. Debido al rápido aumento de casos e internamientos por el COVID-19, anoche la Junta de Salud de Filadelfia aprobó una nueva regulación para mantener seguros a los residentes más vulnerables de nuestra ciudad y para disminuir la propagación de la infección. A partir del día 15 de octubre, todos los trabajadores de la salud en la ciudad de Filadelfia deberán vacunarse contra el COVID-19 a menos que tengan una excepción médica o religiosa. Los trabajadores de la salud con una excepción podrán realizarse una prueba PCR o una prueba de antígenos 2 veces por semana. Todo el personal, estudiantes y profesores de los colegios y universidades de la ciudad también deberán vacunarse contra el COVID-19 a menos que tengan una excepción médica o religiosa. Se requerirá que los colegios universitarios y las universidades ofrezcan una o más de las siguientes adaptaciones para aquellos que tienen excepciones. 1. Una prueba PCR 1 vez por semana o una prueba de antígenos 2 veces por semana. O 2. Aquellos colegios y universidades con el 90% o más de su población vacunada podrían optar por ofrecer a aquellos con excepciones la opción de enmascaramiento doble y mantener al menos 6 pies de distancia social en espacios públicos cerrados. O 3. Si es posible, los colegios y las universidades pueden optar por ofrecerles a aquellas personas que tienen excepciones instrucción virtual. Ya han escuchado sobre la tasa de aumentos de casos y hospitalizaciones, lo cual se combina con los datos de todo el país para pintar una imagen nefasta de lo que nos podría suceder en el futuro si es que no hacemos nada. Esta normativa tiene como objetivo proteger a los más vulnerables mediante la vacunación de los trabajadores sanitarios y tiene también como objetivo prevenir una mayor propagación del COVID-19 a través de la vacunación de los estudiantes universitarios, entendiendo que son los adultos jóvenes, la población con tasa de vacunación más baja y la tasa más alta por infección del COVID-19. Probamos una gran variedad de incentivos en Filadelfia, desde boletos para los partidos de los Phillies y los Eagles hasta nuestro sorteo de vacunas. Pero en cierto punto, dado el aumento de los casos y el aumento de las hospitalizaciones, tenemos que actuar. Hay hospitales en este país que están llenos y lamentablemente los médicos estarán en la posición de tener que decidir qué paciente crítico recibe el ventilador o la cama en la unidad de cuidados intensivos. Si esto sigue así, los departamentos de emergencias tendrán la difícil decisión de indicarles a las ambulancias que tienen que llevar a enfermos a otro hospital, incluso si ese hospital está a millas de distancia. Las personas que necesitan atención de emergencia por ataques cardíacos, accidentes cerebrovasculares o traumatismos tendrán que esperar más tiempo, y para alguno de ellos ese tiempo extra será demasiado largo. No podemos permitir que esto suceda aquí en Filadelfia. Tenemos que actuar. No tengo ninguna duda de que habrá algunas partes de las normativas que tendremos que modificar o cambiar en las próximas semanas. Pero al hacer este anuncio ahora, les estamos dando tiempo a los trabajadores de la salud de la ciudad y a los estudiantes universitarios para que hagan lo que tengan que hacer y se vacunen. Y a las instituciones también les estamos dando tiempo para prepararse. Como ejemplo de este proceso basado en la opinión pública sobre el mandato de la mascarilla, la Junta de Salud aprobó algunos cambios menores para hacer que el mandato sea menos preocupante para los padres de niños demasiado pequeños para ser vacunados. Estos cambios incluyen una nueva categoría de negocios esenciales que incluyen supermercados, farmacias, consultorios médicos y centros de atención de urgencia que simplemente tendrán un mandato de mascarilla para los que no se aplique la opción de mandato de vacuna. De esta manera, los padres no tienen que preocuparse de no poder ir al supermercado con sus hijos, y para quienes deben llevar a su hijo al baño de un restaurante usando una mascarilla, no consideraríamos una violación de este proceso para aquellos establecimientos que aprovechan la excepción de la mascarilla si es que requieren vacunación. Esta nueva normativa, junto con el mandato del uso de mascarillas que se anunció a principios de esta semana, agregan capas adicionales de protección para los residentes de Filadelfia. Y vamos a necesitar esta protección mientras el COVID continúe extendiéndose por todo el país. Pero al tomar estas medidas ahora, esperamos poder estar mejor preparados para las próximas semanas y los meses venideros. Juntos superaremos esta pandemia. Muchas gracias.
Thank you very much, Dr. Betegol and Armando. Now we will move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer and stick with the topic at hand. If there are any reporters who do not get the opportunity to ask questions before we close, please follow up by email and we'll get you an answer. First up, we're going to go to Mitch Blocker from Channel 10. Go ahead, Mitch.
Thank you, Jim. Good morning, Dr. Betegol. Many healthcare providers and universities already have vaccination requirements. Why did the government feel that it's necessary to mandate something that is largely already taking place?
So there are many colleges and universities that are implementing mandates at a variety of times. There are some that are not, and there are quite a few students who would not currently be covered by those mandates. We know that there are tens of thousands of college and university students about to hit our city. So we are trying to make sure that protection is real. It's our highest risk group. Their vaccination rates at that age group are quite low. Their COVID rate is the highest of any in the city.
The regulation talks about institutions maintaining documentation of vaccination. How will the Department of Health enforce these regulations? What are the consequences if people don't follow them?
So we have the ability to do on-site inspections. That's written into the regulation. And the penalties for not following COVID restrictions were written into the original COVID regulations, the emergency order back, I believe, in April of 2020.
Do you have the staff to actually do regulation, to actually follow up and make sure people are following the rules?
I mean, we can do it if we have to. I'm not actually anticipating that that's going to be the major issue here. I think we may have some back and forth with institutions as they think through this for their staff. But, healthcare institutions are very much used to following regulations, and their approach is not usually to ignore them, try to get out of them. That's just not how they approach this.
Is there a precedent in Philadelphia for vaccine mandates? Did you consider in the past when and why the city has mandated vaccinations in its history?
So we have vaccine mandates, for example, for school children. You can't go to school without being vaccinated. There are, again, religious medical exemptions to that. But vaccine mandates are something we're all actually very used to. We've just sort of forgotten about it because the pandemic is just, it's everything right now. But it's very normal to require vaccines. Certain jobs, for example, healthcare. Healthcare institutions typically require vaccination for exactly the reason we are. We don't want to spread disease to our patients.
Thank you so much.
Thank you very much, Mitch. Next, we will move to Johan Calhoun from Chalkbeat. Go ahead, Johan.
Thank you for having me. These questions are for Dr. Betegol. When you say healthcare workers in the city, are school nurses considered in that number?
So it's a broad definition, and it really is any healthcare provider or person who comes into contact with patients or works in a healthcare institution. So if a nurse is functioning as a healthcare provider, I would consider that she would need to be vaccinated. I would be surprised if many of the school nurses are not vaccinated. Nurses are very well aware of the risk of disease. But it's a broad definition. It doesn't include pharmacies and grocery stores and those sorts of sites where people are much farther apart. But otherwise, it includes essentially everybody you would consider to be a healthcare worker or somebody who works in a healthcare institution.
Okay, I find it interesting that we're talking about colleges and universities, but let me ask you this. Should teachers and education workers be mandated to get the vaccine?
So my understanding, and it's from reading the press, but I believe that's something that the school district is discussing.
Are you willing to press the district in possibly considering a mandate?
I talk to lots of people about vaccinations and how important they are. So certainly having those conversations with colleagues in the school district I think they know that. I think they are well aware and considering what they can do. But I can't really speak for them.
Okay, and across citywide, can you kind of break down the numbers of school-age children under the age of 19 who have been affected by the virus by way of the Delta variant?
Do I know I would have to get back to you on the exact number of children under 19 who have, well, actually, we wouldn't have that for Delta variant. So the way sequencing works in this country, we do not have large scale sequencing. So we use it as a way of trying to see what's in the community. A small number, especially of cases that seem unusual, clusters are sequenced. And we look at that so we can say, overall, what do we think is happening in the community? But we don't sequence every case. And actually nowhere in the US are they sequencing every case. So we wouldn't be able to say how many cases among kids are Delta. We can say that the majority of current cases in Philadelphia are Delta. It's more than 50% at this stage. It will soon be virtually all.
Thank you.
Thank you very much, Johan. Next up, we're going to move to Annie McCormick from Channel 6. Go ahead, Annie.
Hi, sorry, I'm in a different truck today, so this is a little awkward video. Real quick, Dr. Bedigal, I know that you have to make a vote when it comes to these announcements. You had that last night, and this is kind of a political question, so it may not be in your wheelhouse, but the state system of higher education that has the number of the universities, there's a lot of comments right now about whether or not it's legal to mandate for those universities that are in the city, because they do, for those who are state related or that rely solely on funding from the state. Is that something that came up in any of these conversations?
We discussed all this extensively with the city law department.
Okay, and is that a concern for you that this may turn into a back and forth about whether or not that maybe these schools will be kind of trapped in some sort of battle about having to make this a requirement, whether or not it is legal?
My understanding is that the Board of Health in Philadelphia does have the authority in a public health emergency such as this one to mandate and at colleges and universities that it is legal.
And also, we talked a little bit last week about guidance that you were giving in regards to the vaccination cards for if businesses were to choose that they would like to go that route rather than just saying blanketed wear a mask. What guidance are you giving the universities and how to deal with that? Is it the normal guidance that they would have for vaccinations that are already required? And is it also the normal medical, not requirement, what would be exemption that they would have for people already for vaccines in place?
Yeah, so it's the same process. We have, which is the vaccine cards. I would encourage them, and we'll talk with them about this, to ask for copies of people's vaccine cards, or to see them depending on whether they're doing this electronically in person, but to use the vaccine card as the proof of vaccination. Medical exemptions typically, would be from a licensed medical provider to the university, and then they have various processes for reviewing those.
Okay, and I think my last question is for the city law department, so thank you.
Thank you very much, Annie. Next up, we're going to move to Isabel Sanchez from Telemundo 62. Go ahead, Isabel.
Thank you very much, Armando. Buenos días. Bueno, mi primera pregunta es en referencia a, la decisión de escoger este grupo de educación superior y healthcare workers como los próximos en tener que vacunarse. ¿Hay algún pensamiento o hay alguna intención de incluir otro grupo también, de que sea mandatorio para ayudar a aumentar este porcentaje de personas vacunadas en Filadelfia?
Question. Buenos días, Isabel. The question, Dr. Bedigal, is given that this decision has been made to vaccinate higher education students and healthcare workers, is there any thinking of having other groups be added for mandatory vaccination to increase the percentage rates of vaccinated people in Philadelphia?
So, as I've said consistently, we will do what we have to do to keep the city safe. This is what we're doing today. And, we're hopeful that this will be enough to control spread and to protect people who are most vulnerable. I can't promise you that we wouldn't be adding other groups to this. It just depends what happens.
Como he dicho anteriormente, nosotros estamos haciendo lo que tenemos que hacer y lo que tenemos que hacer ahora es indicar vacunaciones para estos dos grupos y no descuento la necesidad de tener que vacunar a otros grupos más adelante, pero tenemos que hacerlo ahora para proteger a los más vulnerables en nuestra sociedad. Gracias.
Armando, y mi segunda pregunta sería si se está considerando añadir normativas de distancia social de nuevo para, bueno, fortalecer el uso de mascarillas que tenemos actualmente.
The second question is whether you're considering adding some social distancing rules to the use of masks to help with this problem.
At this point, we're not. The reasoning behind that is firstly that social distancing does not seem to be quite as important as we initially thought compared to masks and vaccines. The second is that implementing social distancing rules has lots of economic implications. Could really, shut down or diminish the ability of businesses to make a living at a time that they're just trying to put things back up. For colleges and universities, it would make it very difficult to hold classes in the existing classrooms. So we're not at this point. That doesn't mean that we wouldn't at some future point, depending on the situation.
En este momento no estamos pensando en incrementar o emitir nuevas regulaciones con respecto al distanciamiento social. Nosotros nos hemos dado cuenta con el tiempo de que no son tan importantes como el uso regular de una mascarilla y obviamente porque también hay dificultades en su implementación. Es difícil hacer cumplir con esa normativa en todo entorno, especialmente para los negocios que tienen unas implicancias económicas severas. De la misma manera, es difícil para los universitarios en las universidades y los colegios comunitarios el mantener ese distanciamiento social. Entonces no lo estamos pidiendo o contemplando por este momento, pero como sabemos, todo puede cambiar más adelante. Gracias.
Muchas gracias, Armando, muy amable.
Igualmente.
Thank you very much, Isabel. Next up, we're going to go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi. For what falls into the definition of healthcare workers, I'm wondering if it includes like home health aides and nursing home workers.
Absolutely. Yeah, they're some of our highest risk and lowest vaccinated workers. So yes, definitely.
Okay. And for those who have an exemption from getting vaccinated, do they need to be double masked or just a single mask at all times?
So for healthcare workers, typically the masking rules are already set by the institutions. We haven't added additional masking rules for healthcare workers in this order.
And what about higher education?
So for higher education, I described 3 options for accommodation for institutions of higher education. So one of them is virtual, and obviously virtual, we're not worried about masking. If they have 90% or more, they could have folks double mask and stay 6 feet apart and not have to test. If they're going with the testing option, we didn't specifically require them to double mask. The double masking is, if they're not going with the testing option, it's just a little bit of extra safety.
Okay, thanks for clarifying.
All done. Oh, all done, Laura. Okay, we will move along. And Laura, if you have another question, please come back to us. Next up, we're going to go to Martin Pratt from Philly Your Black News. Go ahead, Martin.
Thank you. Hi, Doctor. Quick question. If the mandate doesn't seem to be working once college students arrive, will you be doing wastewater treatment to track where the spikes are and identify that on campus?
So wastewater as a way of looking at data for COVID-19 surveillance is something that we've been looking at for months. I get reports on it about once a week. It hasn't really been trending terribly well with cases in Philadelphia. We wouldn't necessarily use it in a campus setting. In campus settings, it depends. If you're having a cluster, then you're going to do contact tracing, case investigation, isolation, quarantine. Those methods are going to be much more reliable. So the wastewater, we use it for general surveillance as a way of kind of having a heads up about what might be coming around the bend in a day or two. But I haven't found it to be terribly useful at this stage.
Last question, would you recommend residents near campus to also double mask?
Frankly, if you're in an indoor space with people you don't know are vaccinated, I would double mask. You know, I've described this before, a surgical mask over, a cloth mask over a surgical mask. It gives you almost as good protection as an N95. It's a lot cheaper. It's a lot more comfortable, you know, just for added safety.
Thank you.
Thank you very much, Martin. Next up, we're going to go to Kennedy Rose from the Philadelphia Business Journal. Go ahead, Kennedy.
Hi, Dr. Bedigal. I just have one super quick question, and I apologize if you've already answered it. But for the rule that certain essential businesses cannot require proof of vaccination, does that only include grocery stores, pharmacies, doctors' offices, and urgent care centers, or will that group be expanded?
So I think there was a little bit of confusion. What we announced on Wednesday was a mask mandate. What we're trying to do is to say we recognize that there are some businesses that have already instituted vaccine mandates on their own. And we didn't want to be forcing them to also mask because they're doing something very effective to prevent COVID. We then heard from a lot of parents who were very concerned that suddenly businesses all across the city, grocery stores, et cetera, would adopt vaccine mandates, which I will be surprised if that happens, especially in places like grocery stores that know that people have to shop with their kids. But they were worried that that might happen, that they would not be able to run errands for their kids. They'd have to find childcare. They wouldn't be able to stop by a place after picking up their child from school. You know, lots of worries about that. So we essentially created this group of essential businesses, which wouldn't be able to swap out and get rid of the mask mandate. So everybody's going to mask in grocery stores. That's going to continue. If the grocery store says we'd like people to be vaccinated, they wouldn't need to bar unvaccinated kids because the kids would have to be. So we're just trying to get around that for parents so people don't have to worry about that.
Okay, great. Thank you.
Wonderful. Thank you very much, Kennedy. Not seeing anybody else in here or with their hand raised, but I do got a couple people trying to get in. So if you bear with us for 1 second to see if oh, actually, we've got Annie looking for another question. We'll be on our second round now. Annie from Channel 6. Go ahead. Oh. Sorry, Annie. It should be. There you go, my Annie.
That's okay. Quick question for you, Doctor, in regards to the announcement earlier in the week. Are masked children going to be allowed in restaurants and weddings if they are hosting a vaccination or maskless event, or can they show a recent negative test? This is kind of a question in regards to, you know, flower girls or ring bearers that are going to weddings and whatnot.
Yeah, you know, people who are planning weddings and special events, I would strongly recommend that they go to the place that they're planning their event. You know, places, what we were saying was the mask mandate is going to apply unless a place has a vaccine mandate. If they have a vaccine mandate, I think people in the routine course of things would assume that everybody is vaccinated in that place. This is a little bit different from New York, which is saying that every restaurant has to have a vaccine mandate. There's a few restaurants in Philly with vaccine mandates, only a few. They expand over time, but there's a few. So, you know, the first thing I would do is call up the restaurant where you have your event planned and see what they plan to do. If that is a place with a vaccine mandate and you're planning an event for which the restaurant's going to be closed, you could probably have a conversation about that with them. You know, are you having a vaccine mandate wedding? You couldn't have an indoor wedding in a restaurant with unvaccinated people there and no masks. I mean, that would be a violation of the mask mandate, and it would put a lot of people at risk. So I think all of this can get worked out. If, you know, we have a call line, 215-685-5488. We're happy to answer questions, work through scenarios with people. There's a lot of nuance to this, you know, but I think the overall goal is to keep people safe. And of course, we want people to have their happy life events, and we will work with them to try to figure out what their various options are.
And last question for you too, in regards to the universities. I remember earlier in the week when we were talking about being able to get access to your vaccine card if you had lost it, and that you have basically a ledger of who is vaccinated. Are you going to work with the universities so that maybe they could be able to provide that they could have a system or access to your the city health department, and that they could take over issuing those cards to their students that may already be logged in the city as having a vaccination?
So Philadelphia has had for many years a vaccine registry, and healthcare providers use it all the time. A child comes into a city health center, parents don't know what the vaccine record is, have no idea what the child got. Nurse can go in, or a school nurse can go in, look at what the child's had, give them any vaccines they need. Now, that is highly confidential data, and it's not available, for example, for HR purposes. So for colleges and universities, with consent, they could send us consent for a student, we could check that record, or the student could ask us for their record if they don't have it. What we couldn't do is have them accessing it for what amounts to an HR purpose.
Okay, thank you.
Thank you, Annie. We're going to go to David Melandra for our last question of the day. Go ahead, David.
I just have a quick follow-up. Yesterday, the Eagles and the Phillies had their first events since this mandate was put in. How do you suggest how they handled everything yesterday? And also, a follow-up to that would be any update about Made in America with the mask mandate?
So I wasn't at the Phillies game or the Eagles game, so I can't speak to what actually happened. But the agreement or the mandate applies in indoor spaces or in non-seated outdoor spaces. So people can be watching a game and have their mask off while they're in their seated area. I believe the Eagles have recommended that people mask while they're seated if they're not eating and drinking. For Made in America, the mask mandate will apply. It's an event of more than 1,000. So people will be either vaccinated or have a negative test within 48 hours, and everybody will be masked.
All right, thank you.
Wonderful. Thank you very much, David. We will now thank you very much for joining us in today's briefing. Later this morning, we'll be posting a blog to the COVID website with a little more details about today's announcements. And then we're going to announce next week's briefing on Twitter and via Media Advisory when the time is set. Thank you very much for joining us twice this week, and be safe.